Epicardial Pacemaker Wires by Deb McElroy. Epicardial pacemaker wires. Does everyone need them who has open heart surgery? It is standard practice for the majority of people who have open heart surgery to have epicardial wires inserted. There are many different opinions on why they should be inserted and when they should be removed. The other topic is how to support cardiac output. Should it be with medications, or should it be with temporary pacing of the heart? Some cardiologists feel the longer the heart is paced, the lazier the heart becomes. Decisions need to be made on what is the best option for the patient to have the best outcomes. PICO. P stands for patient or population, and that is the individuals that have open heart surgery. I stands for interventions, the placement of temporary epicardial wires. C stands for comparison of interventions, not inserting the temporary epicardial wires. O stands for outcome. Not all individuals that have open heart surgery need temporary epicardial wires. When doing my literature research, I used different databases. I looked at different search engines. The two main ones that I used was Discovery and Centel. When looking for my articles, I end up using the keywords epicardial wires, temporary, open heart surgery, and at times I would rearrange the words in different orders to find different articles. How did I narrow it down? Well, I limit the articles for no more than 5 years. Then I would change some of the other words around so there would be less articles. So sometimes when I would look it up, there would be like 500 articles, and then I would narrow the search by the word choices that I used, and it would bring it down to 60, and I would pick the 5 best articles I thought I could use. I thought it was a lot harder than I thought it would be. I thought there would be more concise articles that I want to use, because I was looking more about epicardial wires and when to remove them. But I really couldn't find that much about that. But when looking at the articles, I've learned that not everybody believes that everyone should have epicardial wires. So I felt this was a better topic. There are many complications with the epicardial wires: infection, ventricular fibrillation, cardiac tamponade, hematomas that lead to surgery for evacuation of the clot, and the worst is death. And this is all believed by Bogus, Alhef, Chackin. And who decides on placing epicardial wires? All 5 of my articles and all the authors all say it's the discretion of the surgeon and based on the patient's individual characteristics and whether to insert the epicardial wires. All the authors also feel it is standard to insert them. It is a common routine practice used on the majority of individuals. And who needs them the most? According to Alhef and Chackin, individuals who underwent cardiac pulmonary bypass and had intraoperative arrhythmias, and individuals who have intensive calcification of their valves and are high risk of surgery patients. Yes, Chackin. And why do patients need temporary pacer wires? There's different reasons. Bogan feels for atrial fibrillation, because sometimes that does happen. 1/3 of the patients that have open heart surgery usually have AFib. Elmson feels that for low cardiac output. Instead of using medications, they use the pacer wires instead. Alhaf also feels that for complete heart block or AV node block because of the conduction system. And how are they removed? They all feel that there are two different ways. They can be cut or they can be pulled depending on the placement of the wires and if they're close to the graft. Also depending on the anticoagulations. The other thing is how long do they decide to keep the wires. All the authors feel they should be removed anywhere from 4 to 5 days or close to discharge. And how to prevent complications. According to Alhaf, we should be monitoring the antiplatelets and the anticoagulations when we're pulling the wires or when we're cutting them. If the INR is greater than 2.5, then the wires should be cut because of increased chance of bleeding. Bogus feels that we should hold heparin 3 to 4 hours before removing the wires. 65 to 75% of the individuals do not really need temporary pacing wires, according to the research and the articles that I looked at. Temporary pacing wires are not necessary for all valve surgery. Depends on the calcification on the valves and which valves they are working on, plus the patient's individual history. Temporary pacing wires are not necessary for many individuals who have open heart surgery for congenital heart disease. And there also needs to be more studies to decide if we really need temporary cardiac pacer wires and the predictions and the rates, so we should be using them. And as of right now, there is no standard of when or how to remove the epicardial wires. There's been studies to decide how hard you should pull on them, so there should be more standardized studies done on this.